do you find that most insurances are paying for the naturopathic therapy?
That's a great question. Insurance coverage is, unfortunately, is not uniform as far as naturopathic medicine is concerned. So I would say in general, for naturopathic services that are billed individually or independently, the answer is unfortunately no. And unfortunately, in the state of Arizona, that's particularly true. It's not true necessarily in other states where naturopathic physicians are licensed, but in the state of Arizona, unfortunately, that is true. What we've done at Cancer Treatment Centers of America is largely bundle naturopathic services in with the rest of our services, and we consider them part of the package of services that are offered. So much like you don't get a bill for the service that your nurse provides, that's considered part of the overall package. So we've tended to do that, but insurance coverage is certainly a challenge.
I don't have a question for Dr. Adoo. I just wanted to thank him for coming, and those of us who are his bone marrow patients, transplant patients, miss him, but we wish you well in your new endeavor. So thank you, Dr. Adoo. Okay, I have a two-part question, though, for Drs. Birdsall. One, I heard you mention that there's an increased risk factor with the calcium and vitamin D. You know, we're multiple myeloma patients, so we have to take those supplements. So I'd be curious to hear a little bit more about that. And then part two, I've also heard that sugar somehow represses the immune system, and I don't know if that's true or not. I've just heard that it can, and so if you would address that too.
Thanks. As far as the question regarding calcium and vitamin D, I'm sorry if I was unclear. The risk factors, probably for all cancers, maybe with the exception of prostate cancer, are the higher risk is associated with calcium deficiency and vitamin D deficiency. So it's not that having a lot of calcium is a risk factor. It's actually not having enough calcium, probably with the exception of prostate cancer. What you talk about the sugar question?
The sugar question is a good one because you may read on the internet, sugar feeds cancer, sugar depresses immune function. We know that the table sugar, white sugar, is devoid of nutrients. It doesn't provide us with any particular benefit except being fun to eat. The way that we handle the sugar concern is really encouraging patients to focus on the nutrient-rich foods and to use sugar sparingly and occasionally in moderation. Certainly if you consumed candy bars and sugar-sweetened soda pop and other kinds of things, it doesn't benefit the immune system. It doesn't benefit your body. It doesn't provide building blocks for healthy cells. Occasionally enjoying a piece of dark chocolate after a meal is not a bad thing.
Thank God. I have a question over here about, can you comment a little bit on the difference of the impact on the difference of the different forms of supplements? For example, drinking green tea versus taking an extract over the counter, and how should people weigh that?
One of the challenges with dietary supplements in general are issues of purity and potency and even authenticity. There's an organization called consumerlab.com that has been testing dietary supplements now for 6 or 7 years, and the results are shocking and disappointing. About 25% of all the supplements they've tested have either not been the product that was supposed to be present in the bottle, not present at the levels that were claimed for the product, or they were contaminated with potentially harmful chemicals, heavy metals, other kinds of things. So the question's a great question. It's a really important one. Specifically, green tea, as the example that you mentioned, is interesting because we have all learned that caffeine is potentially harmful to our bodies, particularly related to blood pressure. Although actually caffeine has some other health benefits, which we don't have time to talk about. But and so oftentimes people will choose decaffeinated types of things. The USDA published a very excellent analysis about 5 or 6 years ago on the beneficial compounds in a variety of foods, including green tea, specifically looking at the green tea polyphenols and the epigallocatechin gallate. What they found was that decaffeinated green tea contains only about a quarter to a fifth the level of those beneficial compounds as regular green tea. So when you think you're doing yourself a favor by drinking the decaf green tea, in fact, you're actually also removing a lot of the beneficial components. So potency and purity in the way that things are prepared are unfortunately very, very important, and there's no good resource for consumers to go to help you answer specific questions related to your health. So at this point, the best advice I can give you is that you need to seek out a healthcare professional who can help you sort through all of those issues. I do think, as far as green tea is concerned, I think that I'm assuming that green tea is appropriate for you, not going to interfere with medications that you're currently taking. I like my patients to drink brewed green tea. Unfortunately, the amounts that are necessary for people to drink to have an anti-cancer effect are huge. They're 10 to 12 cups of green tea a day, which is more than I can drink and more than most of my patients can drink. So we're kind of forced to turn to extracts or other kinds of more concentrated forms in order to get the amount in that's going to be useful. And that is where, particularly in the processing, where the risk of contamination with solvents or other kinds of things comes into play. So using products that have an excellent testing program, that are routinely being tested for those kind of contaminants, can be very important as well.
So if an extract is known to have a contraindication with a drug that one's taking, for example, having curry is not gonna impact that treatment. But if you take the extract over the counter, that's where you'll see those contraindications come into place. Is that correct?
Yes and no. There are some studies on dietary curcumin potentially interfering with the effectiveness of a couple of chemotherapy agents, adriamycin and Cytoxan. So there is some concern with some chemotherapy agents with even dietary amounts of curcumin. For the most part, it's safer to incorporate a spice in your cooking than taking huge amounts of it in a very extracted form in supplement form.
I wish we could go on with the